So Janice, it looks like everyone's being let in. Is that correct?
Yes.
Okay, wonderful. Well, hello, everyone. Welcome today to, let me get my notes in front of me here. Welcome to today's IEHP Quarterly Health Education Forum, Improving Children's Health and Equity in Medi-Cal Managed Care, Opportunities in the Inland Empire. I'm Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society. I'm also the chair of the IEHP, or the Inland Empire Community Health Initiative, which, as most of you know, is a coalition whose mission it is to ensure that all families and residents have access to affordable, quality, and culturally sensitive healthcare in the Inland Empire, which includes Riverside County and San Bernardino County. You can always find more on our website at iehpi.org, and be sure to check our Facebook page as well. I want to note that our new name is now the Inland Empire Community Health Initiative, which was recently adopted after the completion of our recent strategic planning process. We still incorporate coverage. It's actually a mainstay of what we do, but community was determined to be a more inclusive and comprehensive representation of our mission. Okay, as we get started today, I do want to welcome our IEHP Board and Advisory Council members, as well as our task force members. I also want to give a shout out, as always, to our IEHP consultant, Victoria Stephan, for always carrying our work forward. Thanks, Victoria, for always being there. We do have a special guest physician and pediatrician on the line with us today, and I would like to mention that he has been a practicing pediatrician and neonatologist in Apple Valley for 25 years. Welcome to Dr. Damodara Rajashekar, MD, who is the president of the American Academy of Pediatrics, California, Chapter 2. We're very honored to have Dr. Rajashekar on the call with us today. Welcome, Dr. Rajashekar. Today also, we are extremely fortunate to have leaders from Children Now and the Children's Movement directing this program. I'd like to make a couple of introductions, then turn it over to them to take us through this fascinating presentation, 2 panel discussions, and some other interactive activities. They will be opening things up to question and answers later in the program. So as always, feel free to enter your questions in the chat feature as we go through the program. And we will also look forward to seeing your raised hand icon if you'd like to participate that way when we get to that part of the program. Children Now and the Children's Movement of California is a network of direct service, business, parent, student, civil rights, faith, and community groups who care about kids and want to see and enact public policies that support their best interests. And if everybody could put your phone on mute, we'd appreciate that. That'd be great. Thank you. California ranks 35th out of 50 states in children's well-being. The Children's Movement works to make kids California's top priority. First, let's gladly welcome Mike Odeh, Senior Director, Health Policy for Children Now. Mike brings extensive health policy and advocacy expertise to Children Now, where his work focuses on health coverage, access, quality, financing, and care delivery. Prior to joining Children Now, Mike worked at Health Access, a California healthcare consumer advocacy organization, and he previously worked at the Center for Children and Families at the Georgetown University Health Policy Institute. Mike has also taught a health policy course at San Francisco State University. He holds a Master of Public Policy degree from Georgetown University and an undergraduate degree from Creighton University. He's also joined me in welcoming Fatima Clark, Senior Policy and Outreach Associate, Health, and the Children's Movement. Fatima joined Children Now in 2013 to spearhead the Covered Till 26 campaign, a statewide outreach and enrollment project focused on promoting Medi-Cal coverage for up to age 26 for current and former foster youth. Currently, she supports Children Now's health and oral health projects with policy analysis, research, and outreach support. Fatima's past work experience includes policy analysis and research, community organizing, and communications and media relations work focused on immigrant rights, economic justice, and health equity issues. Fatima holds an MSW degree from the University of Washington and a BS in psychology from the University of Southern California. I am now very honored to turn our program over to Fatima and Mike. Take it away, folks.
Thank you so much, Allison, for that wonderful introduction. And it's great to see some familiar faces or familiar names in the list of participants. And thank you again to IE, Chai, and everyone for their partnership in hosting today's conversation. Just a quick overview of what we hope to walk away with collectively as a group today. Today's conversation is all focused on improving children's health and equity in Medi-Cal managed care and talking through opportunities in the Inland Empire. Our hope is that by the end of today's meeting, everyone will have a better understanding of the latest trends in children's health coverage, access, and quality, and that we'll collectively identify a list of priority issues in need of urgent action, and that you'll learn and have time to connect to understand timely opportunities that you can take as advocates locally to advance children's health equity here at the local level, but also at the state level. If folks could be so kind as to drop your name and organization in the chat, we'd love for everyone to get a sense of who is on the call today. You all are likely very familiar with each other, but just in case there are folks who don't know each other, it might be helpful to see who's on the call. And if anyone is interested in sharing, maybe I could have 2 or 3 folks who could share a hope that you have for today's conversation and something you hope to walk away with. Invite you to unmute yourself and share that. If folks are hungry or need a break, that's also cool. Maybe you're eating right now. But anyone who might want to share something you're looking forward to walking away with today from our conversation, or just would like to introduce yourself. Okay. Well, maybe we're starting a little early. Maybe folks are getting a snack. We know it's the lunch hour, so we appreciate you joining us. Well, we'll kick it right over to the community panel. I think Allison covered a lot of the housekeeping. Just please mute your lines if you're not speaking. This call is being recorded, so the recording link, as well as an evaluation and the slides that are shared today, will be distributed after the meeting. So please hang tight for that information. We will be taking periodic breaks. Time for Q&A, but please make sure to chat any questions, comments as we go, so that when we have those designated breaks, we can make sure to answer your questions, or it gives us an opportunity to find common themes that we can sort of raise as topics for discussion. Okay, well, I will kick it right over to our community panel. So as we think about improving children's health and equity in Medi-Cal managed care in the Inland Empire, we really wanted to ground ourselves first by having a community panel to share experiences and gain their insights on sort of the urgent issues they see affecting kids enrolled in Medi-Cal, how they see Medi-Cal as the vehicle for addressing those health needs, or where there are gaps and where more work needs to be done. We also hope to hear from them any opportunities they see to promote kids' health and well-being in the Inland Empire. So with that sort of spirit of feedback and expertise from our community partners, I will turn it over. We have 2 parent leaders. Everyone will introduce themselves so they can sort of share their background and why they're joining us here today. But we'll hear from 2 parent leaders, a clinic partner, and then a local pediatrician. So with that, I will hand it over to our parent leaders to introduce themselves and kick us off in this conversation.
Okay. Hi everyone, I am Dee Dee, or Janiero Smith. I was actually asked by a really good friend of mine to see if I can assist in shedding some light on just being a parent and any experience that I've had dealing with, our medical system. Um, and I am. So I have gone through some of the issues, actually, as we discussed some of the questions yesterday, and it made me excited to go ahead and fill you guys in on some of the things that I myself have experienced. I am a single mother of three, and so I've kind of had a lot of a lot of experience going through some of the things here. But I'm also excited to, give my input, get some of you guys's insight on things, from behind the scenes that us parents don't get to see or don't know. And yeah, that's pretty much it. This is really exciting for me. This is my first ever that I've ever had to sit in and do something like this. So I'm kind of excited.
Hi, everybody. To follow up, I'm the other parent here today. My name is Reyna Sanchez. I'm a resident of San Bernardino County. For the past 5 years, I've done a lot of advocacy for Head Start. I'm a mom of four. I've got, I love to say, a very neurodiverse group of children, ages 9, 7, 5, and 19 months. I too have been navigating the Medi-Cal system for approximately 7 years, um, through the ups and the downs, the challenges, the ins and the outs, and especially also addressing children who have special needs and require some additional support. So I'm very happy to share my experiences if that can help families in any way. I do have a passion for community engagement. I love what San Bernardino County does with collaborations. So I'm always willing to share and learn from everybody else. So I'm happy to be here and answer any questions you might have as well. Thank you.
Dr. Figueroa, would you like to introduce yourself?
Yes, hi. So I'm Dr. Brenda Figueroa. I am currently the chair of the pediatric department with Borrego Health, which is a community clinic in both San Bernardino and Riverside County. We are also in the San Diego County, which is where I'm located right now. I have been with Borrego Health for the past 11 years. So I have had a lot of experience with the different communities that we serve, and a lot of our need in pediatrics in the Inland Empire. So I was asked by by your community to participate, and I'm very excited to be here. A little nervous, not sure how much expertise I can share, but hopefully I could be of help.
And then Dr. Pina, do you want to introduce yourself?
Yeah, hi guys. I'm Dr. Pina. I'm a pediatric hospitalist at Loma Children's Hospital. I've been pretty close affiliated with San Bernardino County Medical Association through my residency, and now am a part of Riverside County Medical Association as an attending at primarily our UHS, but I'll do 50-50 at Loma Linda. I am excited to be here. Again, I don't know how much of an expert I am either. I think most parents are probably as much of an expert as I am, but I will try to offer my expertise when possible. Thank you.
Great. So this is our incredible panel. So the first question for all of you, and you can feel free to dive right in. What are the known and sort of unknown urgent issues that you see affecting the health of children and youth who are enrolled in Medi-Cal today, whether that's based on personal experience as a parent or your knowledge working with other parents? What are some of the big issues affecting the health of children in the region?
I don't mind starting if that's okay. So I wrote down a couple of different things that I'm seeing for sure. One of the biggest thing is getting appointments. just a basic appointment. You know, you always hear families with COVID, it's kind of waning. So it's, you know, make sure we're keeping our physicals, make sure your children are getting their vaccines and staying up to date. But sometimes a roadblock is the time it actually takes to see a provider. That's a big issue for a lot of families, myself included. Another thing that I'm seeing both in my family and outside is mental health. The mental health needs of children is always something that is kind of in the background. It's usually something that very few people want to even discuss, let alone admit that there's things going on with our littles. But now, especially after the changes that we've been living in for the past almost 2 years, I see it personally. My 7-year-old was diagnosed with anxiety this last year, which is a lot to take in as a mother, to know that your little person is experiencing things in a really profound way. Another two things that I see as challenges are dental care for our kids, getting into regular appointments, and then navigating what's covered, how long it takes to get approvals back if there's, you know, things that need to be done. So services and the length of time to get those things completed. And then also something as simple as eyeglasses. I know that especially in preschool, littler children, eye problems are something that can also turn into behavior problems because they're not seeing well. So they may act out, they may fidget, they may get up and do things, and it's really because they can't see, as well as hearing problems. So something that simple, I took my children, I even wrote it down, September 21st was their appointment. I did their eye exam, they picked their glasses, and they told me 3 months maybe, and we'll get those into you. So imagine, you know, being in kindergarten and not being able to see appropriately and spending 3 months of your school year waiting to be able to see. So for me, I kind of knew that was coming, and I saved money so I could order my children glasses online and pay out of pocket, which I did, and they came a week later. So, you know, not everybody understands the system and can navigate those things, or has, you know, the foresight to save money to be able to purchase things on their own that are covered. So for me, those are the really big things that I'm seeing that I know are not just affecting my family, but lots of families that are in the Medi-Cal system.
Yeah, if I can, Reyna, I mean, she hit it basically on the head. Those are all the things that, as a parent, that I have also experienced. My son has been diagnosed with ADHD as well as ODD, and I mean, like she's saying, it's the appointments. Like when you call in and you need to get your child is acting up in school, and the school is really aggressive with you getting an appointment, and you can't get an appointment for a month out. You do get these appointments, you go only to be told you're going to have a referral, and the referrals are so ridiculous because that's another whole month or so out. Also, what I experienced, I don't know about Reyna, but even with the referrals, when they send us out, it's like only to get another referral because that doctor can't do anything. So you're going through like 5 referrals before you actually get the help you're needed. And she's right. As far as eyeglasses, I had to wait 2 months for my kids to even get an appointment. Only to be told, like she said, some of the costs I had to eat out of pocket, which for some of us, it's a little costly when you have a large family and all of us need to go get seen for eyeglasses. But everything she said is pretty much, it's right. Like we were told, for glasses, they were backed up with Medi-Cal, and I could experience 8 weeks plus just for us to even get our glasses back. And like she said, even then we had to, you know, they're smaller kids, so they're going to act out because they can't see. You know, that's kind of scary to them when they're excited to be able to see, and they're being told, hey, you got to wait a couple of months before you can actually see things clear to participate. So these are just some of the things. The biggest thing, like she said, is the referrals, and as well as appointments for anything.
Thank you both for sharing those perspectives from your own experience, and then what you're hearing from other families or seeing in your community. Clearly, COVID did not help with sort of thinking about timely access to care and just pent-up demand for services as families delayed care or were unsure, or practices had to accommodate, for safety reasons, the availability of services or office space even at their sites. Dr. Pina or Figueroa, any insights that you can share in terms of what are sort of the urgent issues that you're seeing that are affecting children's health in the Inland Empire, specifically children and youth served by Medi-Cal?
Absolutely. I think Didi and Reyna are right on spot. We went through the questions as well and just kind of discussed it with our leadership team. And we landed on the same exact concerns that they have. Number one, I think, is the access. And unfortunately, one thing that has happened, I think in general, the Inland Empire has been always low on having a number of primary care providers there. So appointment times always are a lot longer. And I think with COVID, that has amplified our need for just having more and more and more availability for those few providers that we do have available in those areas. Same thing with specialty. So I think a lot of things kind of got postponed through COVID. So then that this year, any kind of primary care, I think, has been inundated with trying to make up for whatever didn't happen last year. A lot of the referrals are inundated. So I think just number one, having the access and just kind of having that availability, which unfortunately are a lot of the offices are super duper saturated. So that, of course, is going to increase the waiting time for appointments. Number two, as they said, behavioral health services. I think it increased. I think they were saying there's like a 300% increase in behavioral health referrals over the last year and a half, which obviously, same thing with scarce resources, then you just don't have enough providers to provide that behavioral health care. And when we do have them available, still their wait time is way too long. So it's difficult for parents. And I think that is a similar feeling with the dental and optometry. So I think they hit our concerns as well with what they express. And the other thing that we think is just the fact that even over this past year and a half, while we've been dealing with COVID, a lot of the parents might have even lost like their medical coverage or their services because they haven't been as involved with the care. So then reapplying for those services and just kind of having to manage sometimes our alternatives, which have been more to the resources online and things like that, that the availability might not be there for the parents to be as savvy to retain those services.
Thank you. Dr. Pina?
Yeah, I don't really have much to add because y'all just experted the mess out of this. I mean, this is something we've struggled with for what seems like forever, though. It's referral turnaround time in clinic can be quite long, and then sometimes it gets either lost or we get a new referral coordinator and somehow it gets fallen through the cracks, and that happens. We've seen the same thing with behavioral health, and we're actually doing a QI project right now that's actually studying objective data for suicide and suicide ideation over the past 5 years in Riverside County, which has had a pretty substantial increase even before COVID, but COVID just exacerbated it. So with our lack of resources, it ends up being the primary care doctor's job to be the end all be all, which is difficult in 10 and 15 minute slots. And so you need like an hour for an adolescent that's depressed and a recurring schedule and the dependability to maintain that kind of relationship. So yeah, you guys are hitting things completely nail on the head of the nail. The other thing I think is most pressing is actually obesity. We've seen a substantial increase in obesity rates in our kids, and a lot of it just from the inactivity of COVID and the inability to play sports and go to the park, and trying to be creative at home is difficult. I have 2 boys, and trust me, if they don't want to move, they will find every way to not move. And I'm sure that's true of kids across the country. And so obesity has been known to be a risk factor for COVID, for developing diabetes, for worse outcomes in school settings, depending on snacking and low blood sugars and the cravings. And so I think our access to healthy foods during the pandemic and post-pandemic, and then even sometimes the nutritious meals that are served at schools is the problem that I see happening more often with my Medi-Cal population than any other population. So that's something I would add as something that I think is very important for our patients.
What incredible insights from you four. I'm going to combine, we had 3 questions, but I'm kind of going to combine these next 2 questions, which is all about how there's a tremendous opportunity with Medi-Cal coverage because it's so comprehensive compared to what might be available through other settings. But ideally, Medi-Cal coverage should serve all the needs of children and youth, given the early periodic screening, diagnosis, and treatment benefit, which says, if there's a condition that needs to be that the child has, then Medi-Cal should be able to provide services that help alleviate or ameliorate that condition. So thinking about the opportunity in Medi-Cal, and as we're coming, quote unquote, out of COVID, but I feel like there's always a new wave or something happens. What sort of do you see as from your perspectives, if you have a recommendation or a suggestion of what's really needed to promote children's health as we move forward out of COVID, what might Medi-Cal be able to do to help address the need or the gap? I know obviously getting more providers so that we can have referrals, but also thinking about other ways that Medi-Cal coverage can help fill the gap, and sort of what would you like to see as we emerge and return to more normal life post-COVID?
I think for me, it would be a lot of easier transition once we get our kids in there for, like she said, dental appointments and things like that, as well as I would love to see more mental health, things more with mental health, seeing as I have a child that goes through it. Like I said, it has been a little bit of a struggle to find a decent doctor that will even take certain age groups. I did encounter the fact that and I was surprised, was not a lot of doctors that dealt with a certain age group of children that has behavior health issues. So it was really, really hard. But if there was a way that, because there are kids very, very much so younger that are getting treated for mental health issues. If we could see more doctors or have more resources to reach out to other areas and get the help that's needed for them. And that would be great. As well as I feel like the health coverage gives us some of the bare minimum. That's it. If they were able to do just a little bit more with things, so that some of us parents aren't having to eat the cost for larger families, say a family of 4 or more. And also with the nutrition, as Dr. Pina said, it's some of us have, and I've experienced families that have applied for Cal Fresh and things like that, but it was a little difficult for them to even get, especially with COVID and emergency issues. It took them over a month to even get emergency. So if we were able to have the resources to expand, that would be so great.
And then I can definitely add to that. I think, of course, obviously providers are huge. Specialty care is huge. I think if people, organizations that are, doing their hiring, doing these things, being proactive in the sense that knowing that children and family who previously may not have been on your radar for experiencing trauma and having mental health issues, that's kind of gone. At this point, most of the children coming back to school and trying to live their lives as normally as possible are all feeling traumatized. So knowing that even as things go back to normal as much as they can, that it's going to be a while for kids to recover. And we always hear kids are resilient, but it doesn't mean that they should have to be resilient. We should work harder to help ease that transition. And I think another thing that would be really important is kind of reestablishing that trust, right? That, you know, when you're little, you want to be a doctor. You hear it all the time, you know, when I grow up, I want to be a doctor. And coming out of this, I remember just for me, you know, reading every day and learning about statistics of what was happening and building back that trust of knowing that, you know, there's light at the end of the tunnel. We are, you know, approaching new treatments and new ways to get people back into the world, getting our kids back on track with their vaccinations. I'm sure there's families that, you know, they didn't go. I had a baby during the pandemic, so my baby was born the day the hospital locked down, and she wasn't seen by a doctor for 2 months. So, you know, and this is modern times here where even a newborn baby was over the phone, how's your baby doing, you know? And so I think it's going to be a lot of rebuilding back that relationship between our amazing pediatricians and our very skilled healthcare workers and the families who have been at home kind of nervous and wondering, you know, when is our next meal going to come, and all of the things that were going on. So for me, it would really be a proactive approach and understanding when these families are coming in, what they've been going through too. I know all of us have experienced trials during this time, but if you also compound that with, you know, losing your job, potentially being evicted, having bad health previously anyway, you know, those are really big obstacles without adding in a pandemic and homeschooling your children. It has not been easy for most people. And so I think having that in the back of your mind when these people finally do get an appointment after waiting a month, that, you know, there might be some trepidation there might be some unease, and kind of helping break the ice again, and letting parents and families know that, you know, there are people, there is support there. So those are really, really big, I think. And just getting services back on track. For me personally, I have a child with autism, excuse me, who required ABA therapy, which we did in the home, and that was immediately stopped, and it was over Zoom. Now, if you've ever tried to do anything with a child over Zoom, you know that that's a mess. Now, trying to do that with a child with autism who's actually trying to learn a skill, it was terrible. And then, like our other wonderful mom here, my 7-year-old has ADHD and anxiety, trying to navigate getting services for him when there aren't any. And now, luckily, they're coming back, but I know there's a lot of families, kids who need OT and speech therapy, that they're not happening yet. They're still, you know, that COVID wall of, well, we can't be in person and we can't do this, but there's certain things that they need to be done in person. So that's from my perspective. I know that I'm grateful with, especially prescriptions. I know that I couldn't afford the things that my children need. A lot of times I have an asthmatic, and getting inhalers and all the things that comes with that, specialty care, getting the therapies and services. It is wonderful. But it's getting to that point that is just such a hard road. And a lot of parents give up. It's too difficult. They can't manage, or they need outside help. So anything to kind of make that road a little easier. And of course, empathy goes a long way too. So
Thank you.
Mhm.
Dr. Pina or Figueroa, any thoughts on sort of looking ahead? How can Medi-Cal help address the needs that you're seeing, or fill any gaps, and sort of what comes to mind as what's most needed urgently as we sort of return to more normal life?
Yeah. So I mean, I want to say that although some of the things that are mentioned for like certain therapies, obviously telehealth is probably not the best option. What I do think it has benefit a lot is at least to have that contact with the patient, even if you can't have them physically. So a lot of the primary care things, you know, the management of asthma, the management of obesity, nutritional counseling, things like that. I think the allowance of it being, you know, telehealth and the allowance of medical covering for it as a visit has really helped and will continue to help that lack of access. I think, you know, for behavioral health, especially older children and teenagers, I think it has been a huge advantage to be able to conduct those visits via telehealth, which probably, you know, allows for a provider to be in another county and still be able to provide care for those patients on areas where they wouldn't have access otherwise. So I think the allowance of telehealth is definitely important, and we hope that that's something that, you know, we advocate for to continue, because I think that has opened a lot of access to those sort of problems. As I totally agree, you know, certain therapies, speech therapy, physical therapy, OT, ABA, those things definitely need to be in person. I think they're much more beneficial. So maybe partnering with community resources, you know, that could actually provide. I mean, we can recruit to have all of these providers available. You know, I think through COVID, the whole job market has completely changed as well. So I think probably relying a little bit more on community resources where this kind of therapy could be provided by, you know, a Head Start program or some sort of school system might help the parents to have a little bit more access in those areas where providers or licensed providers might not be available for months and months at a time.
Thank you. Dr. Pina, any final thoughts?
Yeah, I agree. It's been a rough road. I know our clinic was blessed enough to never to have to actually close. And so even throughout COVID, we were still seeing people in person, and that was an opportunity that I know private practice doctors didn't in some other institutions. And so I was really happy to still be able to provide care to the patients of our county. But I understand how difficult it was for people to get appointments and follow-ups and specialists. And so that compounding an already incredibly stressful and unfamiliar situation definitely was difficult. And I totally recognize that. I think we have an opportunity now that kids are back in school to utilize the school system more. This is a place where they are consistently present. And I wonder if Medi-Cal, I'm sure it's across the board a few times to have opportunities for counseling and therapy that is funded through Medi-Cal or facilitated through Medi-Cal in combinations with school districts, because the teachers are probably, outside of the parents, the ones most likely to recognize symptoms of depression and anxiety before a provider will. And considering it's taking a long time for people to get into clinics now that everyone's needing to catch up on vaccines and get their specialist care, I think there is an opportunity to form a partnership with the school districts to see how we can better serve them to better care for their kids. And I think parents would feel better knowing that there is a mental health program in place or some type of connective resources through the school system. So when they drop their kids off at school, they know that someone's looking out for them. And I think that would go a long way. And then we can provide resources and be an assistance as well. So I think that is an opportunity for Medi-Cal. I think we have a lot of room to grow and a lot of opportunity for growth. And I never look at a long goal as a deterrent. I think of it as a opportunity to achieve great things. And I think Medi-Cal can do that.
What a wonderful, wonderful conversation. It's great to end on a positive note. And thank you all for being part of our community panel. We are now going to transition a bit into, we're going to do a quick poll because we know everyone who's joining us today has thoughts. And so we'd love to capture your thoughts through a quick poll in terms of what you see as the most urgent issues in your community, and then sort of what Medi-Cal as a program can do to better serve kids and to have a greater impact on the needs of kids. So we're going to launch a quick poll. And then if you have any questions, I see some coming up already in the Q&A, please drop those in. So thank you to our community panel. And now we want to hear from everyone else. So give me 1 second to launch the polls. So you should see them on the screen, the first question of 2, or they might both be showing up on your screen. So the question is, what are the most urgent issues affecting the health of Medi-Cal enrolled children and youth in your community? You can pick as many answer choices as you like. And the second question has to do with what's one change you would like to see the Medi-Cal program implement that would have the biggest impact for kids and families?
Fatima, excuse me for interrupting, but I'm not seeing the poll questions. Is it just me or is everyone else seeing them?
I see some responses starting to come in.
Okay, so maybe it's just my screen. All right.
Maybe as co-host, maybe we can't see them. I can launch it, but I can't reply.
Okay, as long as the rest of you are seeing them, that's good.
Yep. So I'll just give it a couple minutes for folks to read the long lists of options. The second question, there's only one choice. So it might take some time for folks to pick their top choice. And then I'll share out so we can see what the feedback from the crowd is.
Okay, I don't know about you guys, but I tried to submit. I don't know if I was supposed to submit at the bottom of the thing, but it didn't let me submit my choices.
So there's a second question. You might need to scroll down to answer the second question, and then it will let you submit.
Okay.
Thank you, whoever provided that clarification.
Thanks.
It was Marcy. I kept trying to submit and it wouldn't work as well. And then I figured it out.
Thank you,
Okay.
Marcy.
So can you guys help me get it back on there? I can't see it. Mine disappeared. I don't know where it went.
I can also, what I'll do is I'll drop these in the chat. And that way, if for some reason it's not working, feel free to provide your response. So 1 second while I do that. Where is my chat box? Okay, so here are the options, and feel free to, oh, it's not letting you. Okay, well, I will do that soon after, but for now, I will end the poll since it looks like most folks, we got a good 82% response. So I will close out the poll, and anyone we missed, you can share your thoughts via the chat. So here are the results. Can everyone see the results on the screen? So in terms of what are the most urgent issues affecting the health of Medi-Cal enrolled children and youth in the community, it looks like that access to mental health and behavioral health services, which everyone on our panel talked about and discussed, access to routine or preventive care. So a lot of in terms of access to services, access to different screenings and providers. In terms of what is one thing you would like to see in the Medi-Cal program that would have the biggest impact for kids, more providers, but also, which our parents talked about, is more of that coordination support and navigating all those different services and setting up appointments, transportation, anything that comes with actually getting to a provider, and then better integration with school and community settings. So we had about a quarter of folks who said that's another key aspect. So right in line with what our community panel shared. So thank you all for participating in that poll. We now just want to open it up briefly for some Q&A. Soteria, would you mind helping us with any questions that you saw or comments that you can lift up for us from
Sure,
everyone?
no problem. Let's see. Okay. There is a question from Dr. Rajashekar. It says, can you please share what kind of advocacy efforts are in place at this time to address these issues and where we are to reach our goals?
I think we'll get into some of those answers in the presentation that's coming up next. So
okay.
If there are still questions after that, let's talk.
Okay. And let's see what else. That's all I see in there right now. Others are just comments if you want me to read those. Oh, I'm sorry. There's one from Victoria at the end. Community partners can offer support programs that help medical professionals and families. BYUT need funding to offer expand services, including educating parents regarding interventions activities in the home. Can community partners be funded by Medi-Cal?
Great questions. And actually, as we transition to the next part of our conversation, we'll actually be highlighting some of the great things that are coming to Medi-Cal as part of this year's legislative and budget sort of priorities that were put forth. My colleague Mike will give us an overview of what the latest data, what we're seeing in the latest data around children's quality and access to services and, you know, sort of performance in the Medi-Cal program, but it'll also highlight state and local opportunities, what's coming down the pike that can help strengthen children's health coverage within the Medi-Cal program. So great segue, and I don't see any other questions or comments. So I will actually turn it right over to Mike so that he can sort of ground us in what's the latest data, what are we seeing, and we can then dive into a fuller discussion around opportunities.
Thank you, Fatima. And just to quickly answer Victoria's question, policies are changing where there will be more Medi-Cal support for community partners. So those things are coming. They're not here quite yet, but they are coming soon. I'm going to try to, let me see if I can share my screen and not screw it up. Okay, can folks see my screen okay?
Yeah, it looks good, Mike.
Yes.
Okay, great, thank you. So I'm Mike Odeh, Senior Director of Health Policy at Children Now. I'm going to share a bunch of data to give us some context of what Medi-Cal looks like statewide and in the Inland Empire based on some of the publicly available data that we have. I will say that this data is all pre-COVID, so it was a different lifetime ago, but I think it's also very informative of kind of where we're at. So I'm going to go through these relatively quickly, but these slides will be shared and happy to take questions. I first wanted to point out that we know that Medi-Cal serves a diverse population of children and youth. About 2/3 are kids of color. This is statewide data, but we know that the Inland Empire is also a diverse place. And so I imagine it would look somewhat similar in terms of what kids are covered by Medi-Cal. We also know that kids with Medi-Cal are more likely than kids with employer-sponsored coverage to have no usual source of care besides the ER. So that means that rather than going to a usual primary care pediatrician, they would go to the ER as sort of their usual place. This doesn't really make a lot of sense because the vast majority of kids in Medi-Cal are enrolled in a managed care plan that is meant to manage their care. In the Inland Empire, as you all well know, there are 2 plans in both Riverside and San Bernardino counties. About 10% of the kids in Medi-Cal enrolled in those counties are enrolled in Molina. The remainder are enrolled in the Inland Empire Health Plan. We also our research has also shown that there are persistent healthcare challenges in the Inland Empire. One of them being schools offering comprehensive health services. And so we know that there are some school districts that have high rates of school dropouts, but there was only one school district that had comprehensive health services. We know that transportation, substance abuse issues, mental health access are also things that have long been an issue in the Inland Empire. I'm going to dive into some data. This is all pulling from data that's publicly available from the Department of Healthcare Services. And I'm calling it a chart book, but it's really comparing some of the statewide data to the data for Molina and the Inland Empire Health Plan to give us a sense of what it's looking like. So starting with access to pediatric primary care appointments, it looks like kids in the Inland Empire are generally able to have access to primary care appointments in a timely way. Still some room for improvement. It looks a little bit better compared in the Inland Empire for specialty care appointments compared to what happens statewide, and that may speak to some of the specialty care centers in the Inland Empire that some other regions don't have. Loma Linda in particular comes to mind. Mental health appointments, on the other hand, are generally below the statewide average. And I should have said the bars on the left-hand side, the dark green ones, are the statewide average. That lighter green is the Inland Empire, and the lightest green is Molina. So if that helps you, they're all these charts go in that order. When we look at routine immunizations, so we're not talking about COVID vaccinations, we're talking about measles, mumps, rubella type of routine vaccinations that kids should get. Rates are generally not where they need to be statewide. In the Inland Empire, for both plans, they're even a little bit lower. For well child visits, we're seeing the same thing. So for infant well child visits, which is that chart on the left, those are for infants under 15 months. And I think tracking with what Reyna said, even pre-COVID times, kids were not getting to, especially little kids, were not getting to the doctor the way that they should. So these rates are pretty low. We know as it relates to vaccinations, when COVID happened, those vaccination rates dropped across the board, across the state, about 40%. But even as of this past summer, 14% of caregivers in the Inland Empire said their young children were still experiencing vaccine postponement. So there's not only were rates low to begin with, but when COVID happened, we're still kind of behind. I know there are a lot of resources out there trying to address how to improve well child visits and immunization rates, and so you can see some of them listed here. But some of the ideas like telehealth, as we heard in the discussion, don't work for all services. And so there are some parts of a well child visit, like maybe you can do a screening virtually over telehealth. There are some things like administering a vaccination that you just can't. So I think being creative of how to better deliver those services is helpful. But I think the other thing is understanding what precautions are in place around safety and making sure that parents understand the importance as well. When we look at screenings, we know that about a quarter of kids, infants and toddlers throughout the state are getting a developmental screen. It should be a bit closer to 100%. In the Inland Empire, it's even lower. So that's an area that we think maybe could use some focus. Similarly with blood lead screenings, 2-year-olds in the Inland Empire are getting fewer screenings than kids statewide, although that rate is also really low. With trauma screenings, it's a relatively new kind of benefit in Medi-Cal. And again, we see some variation, but overall, all of these numbers are really, really low. Same with alcohol and tobacco use screenings. We see the Inland Empire doing a bit better, but when than the state, but when the highest rate is 3%, that's probably not high enough penetration. Depression screenings, I know we talked a bit about behavioral health. Depression screenings for adolescents, the Inland Empire is actually doing a lot better than the rest of the state. But again, that a lot better, being about a third of kids is probably not enough. Chlamydia screening for teen and young adult women is about on average with the statewide rate, so roughly 60%. Dental was mentioned earlier. So when we look at fluoride varnish, we see that kids in the Inland Empire in the 2 health plans are below the below the statewide average, which again is really only about a quarter of kids, so still too low. We look at when we tried to look at chronic disease, particularly around asthma medication management, we saw that there was rates in the Inland Empire were just slightly lower than the statewide average. So some room for improvement there in terms of managing what can be a controlled disease. I wanted to point out with this chart that when we looked at the statewide data broken out by languages spoken at home, we noted there were notable disparities. So here we're showing that on something like immunizations, Chinese-speaking families were getting much higher rates than the statewide average, and then much higher than Farsi-speaking families, for instance. So given what we know about the diversity of families in the Inland Empire and the languages, the variety of languages they speak, we can assume that there are also variations by language in the Inland Empire. We don't have that data, but what we do have is awareness of interpretation services among among providers and health plan call centers. So some folks don't know that interpretation services are available through Medi-Cal. Most providers in the Inland Empire and throughout the state know that that's available. Health plan call centers, which is maybe where a parent would go for that support, less so. So I think this is an area that could really be improved, particularly through some better training, as well as better resources to make sure that that interpretation access does not hinder access to the service itself. We looked at some consumer ratings of healthcare. It's called the CAP survey, some of you may be familiar with. It looks like consumers generally report that children in the Inland Empire can get care and get care quickly. So that's slightly better than the statewide average. When it comes to the rating of the health plan and all of their healthcare, it looks like the Inland Empire scores slightly higher than Molina, but again, around the statewide average. So generally, I guess I would summarize that consumers are generally satisfied with their healthcare and their health plan, although there is room for improvement. I think one of the important ways that plans can get feedback is through their member advisory committees. Both Inland Empire Health Plan and Molina have advisory committees made up partly of members where consumers can participate. They function differently. Each health plan does things a little bit differently, but there are ways to get involved. And so would encourage parents who are interested in really participating in those forums. I'll spend a minute on this slide because there's a lot of bullets, but really there's a lot happening in Medi-Cal coming up next year and in the years ahead. So there was a question about community support in Medi-Cal for community resources. There are going to be new benefits rolling out, access to community health workers, to qualified asthma preventive services providers, doula benefits. Those are all happening next year. There are things, non-traditional Medi-Cal services called community supports. Up until about a month ago, they were called in lieu of services. These are things like respite care or asthma remediation. Those will begin coming online next year. For some child populations, it's not until 2023, but some of those things are being built now. The state is participating in an infant well-child visit learning collaborative to really boost those infant well-child visit rates that are too low. So I think those will have some ripple effects. There's also going to be new incentive payments to health plans to improve student health and build out some of that capacity. So there's a lot happening next year. And then in the years ahead, we're seeing new managed care contracts. So the state is rewriting those contracts. And so it's a really critical time, but those contracts won't start until 2024. But those contracts will incorporate a lot of these new changes and benefits. There will also be a population health management service, enhanced care management benefit for kids, additional community supports, and some other incentives, including more value-based payments to help focus health plan performance in an improved way. So there's a lot happening, and I know I just scratched the tip of it. I encourage you all to ask us any questions, both at the Q&A or separately offline. But I next want to turn and have a conversation with our health plan partners, because they are really at the forefront of implementing a lot of these policies, and they do have a lot of power in how some of these resources are focused. So I'm going to stop sharing my screen and invite Dr. Wada from the Inland Empire Health Plan to engage in a conversation with me. So Dr. Wada, would you like to introduce yourself?
Sure. Hello, I'm Dr. Takashi Wada. I'm the Chief Medical Officer for Inland Empire Health Plan.
Thank you for being here, Dr. Wada. And unfortunately, we weren't able to get anyone from Molina to join us on the health plan panel today, but I'm excited for you to be here. And I thought I could just ask you a few questions and see what's on your mind, since I know you're in the thick of this and probably familiar with all of the stuff I presented. But based on what you heard and what the data is showing you, what are some targeted investments or plans that Inland Empire Health Plan has to prioritize the health of children and youth?
Sure. No, I mean, that's a great question. But before I get to my response, I just want to thank Children Now, IEHP, the parent reps, Ms. Smith and Ms. Sanchez. Your insight and experiences are so valuable for us here at IEHP to learn and figure out how we can better serve our Medi-Cal enrollees. Also, thank you to Dr. Figueroa and Dr. Pina for your perspectives, and I'll comment a little bit on some of the things that you said. One of the real values for these types of gatherings is that I get to learn so much. So aside from what I'll talk about in terms of what Inland Empire Health Plan is doing on some of these critical issues, it's also great for me to get that feedback. We cover 1.4 million members across the 2 counties. So we have a big chunk of the population here in the Inland Empire. We contract with over 7,000 providers. And so as a health plan, there are things that we can do on our own. We're not the ones seeing the patients, but we can work through our providers. And we can work through partners. And then, if things are more at a state level or federal level, we can have an advocacy role, much like Children Now and the great work that you do in trying to improve the system of care for children. So, just real quick comments on some of the things that were said earlier so that I don't forget. Getting appointments and the availability of doctors, that is something that we're looking at all the time. It's something really important to us. As Dr. Figueroa mentioned, we do have a very low percentage of primary care providers in the state compared to our population. And so we have, we're always trying to find ways to expand on our network to bring in good quality doctors. We have a network expansion fund where we try to incentivize, additional money for providers that come into our area. We have medical student scholarships for our local medical schools so that they can stay in the area. We're trying to access, other means like telehealth, even though it has some limitations, as you pointed out. We have e-consults where providers can have discussions with specialists instead of sending our members long distances to see a specialist. Sometimes they can get that, electronically. So those are some of the things. Mental health, huge issue that I heard brought up by pretty much everybody. And that's something that we're really working on to try to improve the system of care. It's very complicated. The health plans like IEHP and Molina have part of it, and then the counties have part of it for those children that have more serious issues or emotional disturbances. And so the system is fragmented, and so we're always struggling with how to better coordinate that care and make sure we have access. Dr. Pina, I think it was mentioned, the opportunities through schools. So there's a big school-based behavioral health initiative coming in 2022, where I think about 400 million for the state is coming down through health plans for us to enhance services, behavioral health services available in the school setting. And so whether that's putting in behavioral health counselors or providers in the school setting or community health workers, we're going to be reaching out to our school partners. We've already met with some of the school districts to get ideas, but that's coming in 2022. So you had a great idea there, Dr. Pina. Eyeglasses, I will check in on that because it shouldn't take 3 months to get some eyeglasses. Referrals, another big issue for us. We're going to try to get better with that through CalAIM, which I'll talk about in a little bit, in terms of coordinating care for some of our complex children. We know there's fragmentation there too when children have CCS, California Children's Services, that has to be coordinated with the health plan. So, I'll definitely, this is so valuable for me here at IEHP to try to figure out how we can do things better. And as the statistics pointed out that you showed, we have a lot of opportunities for improvement. Some of it doesn't capture all these great things and programs that we're trying to do, but there's no question we need to do better. We're trying to do things here at IEHP. We're trying to partner on some other things that really require sort of that collective impact. And really the state is also bringing down a lot of new initiatives as well. So a lot of things coming down, for us here at IEHP, we have different tools that we can use to try to move the needle, with our providers as education and training. There's payment incentives. So we try to incentivize through our pay for performance program, a lot of these childhood measures. And so, that's a way that we can try to influence the behavior of our providers. We can provide support to our providers in terms of training and grants and technical assistance as well. We can oversee them. That's one of our responsibilities as a health plan, to make sure they're compliant with Medi-Cal and providing good quality care. For our members, same thing, education and outreach that we can provide, incentives. So there's some things that we offer a gift card, for our members that go and get their childhood vaccines or the COVID vaccine right now. Really important for us to try to reduce barriers and provide support. So whether that's transportation, access to healthcare, trying to coordinate all these referrals, something that's really important for us as a health plan, to try to make it as easy as possible to get the care that our members need and deserve. And then there's a lot of health plan direct programs and activities that we do around care management. Our pharmacy reaches out directly. We have a lot of programs, as you mentioned. Asthma is an issue. We have a pilot program in San Bernardino County where our pharmacists are working directly with families on those medications because they're very complicated. We're partnering with First Five and Loma Linda on a Help Me Grow campaign that's doing a lot of outreach and education and referrals and screenings. We have some, as I mentioned earlier, telehealth programs, adverse childhood experiences, the ACEs screenings, where we have some partnerships on that to try to identify those risk factors early on so that they can be addressed. So sorry, I went on kind of long, but there's just so much that can be done and that we're working on through IEHP.
No, that's great, Dr. Wada. Thank you for that. Are there anything, how is the health plan thinking about reducing some of the racial, ethnic, and linguistic disparities among children and youth?
Yeah, no, we definitely see disparities, as you highlighted. They can be based on race or ethnicity. Sometimes they're geographic. And so I think one of the key things that we're doing more and more of is really looking at our data and identifying and then making our providers and everyone aware of those disparities. So that's kind of the first step. One of the things we have as a health plan is all that data on our members, and we get data on the care that's being delivered. And so we can sort of analyze that and identify. So when we look at all the metrics that you pointed out, the rates of immunization, well child visits, screens for depression, we can actually then break that down into the different subpopulations and then do targeted outreach or targeted interventions and programs for them. So one example is, some partnerships we're doing around Black infant health, because we identified that as a disparity. We're working with our county partners on that. When we do outreach, we do break it down by high risk. And so again, we have to, if that's based on race, ethnicity, or by geography or other sort of flags in our system like homelessness, we can target programs specifically to those individuals. And then I think we can learn with our COVID experience of how to outreach using some non-traditional partners. So I heard one of the parents mention trust, and that is so important in delivering care, because a lot of families, a lot of these patients aren't even getting in the door. So when we talk about access and the quality that happens within the clinic, a lot aren't even getting there because of trust issues or barriers like transportation and childcare, getting time off from work. So trust is a big one. We're looking at utilizing community health workers who can help with that education and navigation, who are from the communities themselves. We've worked with the faith community, African-American pastors, the Catholic Church, and really looking for some of those trusted partners to help us get information, timely and accurate information out.
Great. And you sort of touched on this a little bit with schools and First Five and community health workers and faith organizations, but can you speak to how you all are thinking about actually supporting community-based organizations and other community resources?
Yeah, absolutely. There's so many influences on healthcare that happen even outside of the healthcare system, and so we rely on those partnerships, and whether that's community-based organizations or schools, the faith community. There's so many different partners that all touch pieces, and we all need to kind of collectively work together. So absolutely, as I mentioned, there are a lot of initiatives with First Five that we're partnering on. We have the big school initiative coming up on behavioral health. We're working with a lot of other community-based organizations through Connect IE and other opportunities for referrals and making sure that those systems are in place. Cal AIM was mentioned recently. This is a statewide initiative. It actually stands for California Advancing and Innovating Medi-Cal, and it's sort of a redesign, refresh of the Medi-Cal system, and really allowing us as a Medi-Cal health plan to start covering some of these community supports that you mentioned earlier. So there's a lot of money that's coming to the health plan to help support housing, things like recuperative care. You mentioned asthma remediation. So now we can go into the homes and get air filters that are triggering asthma attacks and things like that. So we can get air filters to try to prevent those allergies, home modifications, medically tailored meals. So there's of course eligibility criteria necessary for that, but we'll be able to do that. And some of these things we were actually doing in IEHP even before Cal AIM. So we've been doing a lot of food distribution, healthy food options through our community resource centers. And we've been doing a lot of work around housing and homelessness. When our community resource centers were open, and unfortunately this is a limitation of COVID, but we used to do things like education classes in our resource centers and food classes and things like that. So there's a lot of opportunities to partner with community-based organizations who are doing some of this work. Another key part of Cal AIM is called enhanced care management. So these are community-based teams that are going to be working with our members in the community that have the highest risk. So a lot of complex children, they might have California Children's Services as covering some of their care. But we'll have teams, multidisciplinary teams doing the care coordination, the outreach, the health promotion, and some of those will be in CBO settings as well.
That's great. You seem very excited about the opportunities with Cal AIM, and I think you guys seem well positioned to take advantage of many of those. So excited to hear all of that. My last question for you, and so folks should be thinking about questions they want to ask Dr. Wada, and please put them in the chat. So I mentioned the member advisory committees, which I think are just maybe one venue that you get stakeholder and consumer feedback. But do you have any thoughts or advice on the way that consumers and patients can engage with the health plan and provide some of that feedback about their experience?
Yeah, sure. So you did mention the public participation and policy committee. That's about, I think, 25 or so of our members that have IEHP insurance, and they meet regularly to provide us feedback, and we can announce different programs as well, and get ideas. So great learning opportunity for us. On the provider side, we have provider advisory committee and some community advisory committees as well. We have a community partner quarterly meeting for CBOs and providers. And then for members, we also have, let's see, it is the Persons with Disability Committee. And so individuals with disabilities can participate on that. And so, there are opportunities. And then we do also have sometimes targeted opportunities where we want feedback. And so there are those opportunities as well. But primarily, I would say the Public Participation and Policy Committee.
Great. So I see a question in the chat from Dr. Figueroa. How do members get acquainted with all the possible benefits they get from their health insurance that they may not be aware of?
Yeah, no, that is definitely an issue, especially with all the things coming in 2022. So of course, there is just the general information that gets sent out to everybody. A lot of this information is also via the website. But this is also where we can work with our providers in getting the information out. With CalAIM and everything that's going to be available, we'll be doing a lot of presentations out in the community, both for providers and CBOs, but also members. We have newsletters that go out to members as well as our providers. For certain things, we're able to do text messaging and social media. So we're trying to take advantage of some of those modalities also. So yes, that is a big issue. Sometimes people don't know of all these great things that are available through IEHP.
Yeah, and this is sort of a follow-up on the text messaging point. Are there health reminders sent through Medi-Cal outreach members on a regular basis? And is that from the health plan or is that from sort of the direct provider?
Well, certainly the individual providers can communicate with their patients. We're a little bit more limited. There's certain regulations right now around text messaging, and we're doing a lot with COVID because the urgency. The state has relaxed some regulations around that. So we're doing a lot of outreach around COVID, getting our members and identifying those that aren't vaccinated into vaccination sites. But yeah, some of the other things we are a little bit more limited in terms of what we can do through that mechanism. But again, we have a lot of other opportunities to get information out. We can do public service announcements. Some of you have seen IEHP billboards, and so again, also utilizing our community partners as well.
Great, thank you. Are there any other questions for Dr. Wada? Okay.
I have a quick comment. Just for having being part of Head Start for so long, IEHP has been such an amazing partner coming to the resource fairs at the preschools. And I have to say, just as a mom, having the superhero mascots is brilliant. It was super effective. We did a resource fair here in Yucaipa where we had our senior ukulele group playing kid songs, and the wonderful superheroes were out there dancing with the kids. And it's just, for me, it's really great to know that such a big organization and people who are out there can come out here in our little communities and get involved. So just on a side note, I have to say that IEHP, you're doing a good job with outreach and I think really smart marketing for sure. So congratulations on that one. It was very, very, very effective.
Great, thank you for that feedback, and I'll give credit to Marcy. I know she's on the line right now, so she's in charge of a lot of that stuff. So yes, we're definitely proud of our outreach and getting out into the community. That's really a part of our mission, and our core values is really to be engaged with the community and be open to that feedback. So thank you.
That's great. Any other questions or comments? And shout out to Marcy. So I think if I'm not seeing any other hands or things in the chat. So thank you, Dr. Wada. Really appreciate you being here and for all the information you shared. I think we wanted to open it up to more of a group discussion to see what's on your mind. I think a lot of important issues were raised in the conversation today. But wanted to open it up a little bit more. So I'm going to turn it back over to Fatima to guide us through that discussion.
Thanks, Mike. And thank you, Dr. Wada. So much of information has been shared with you all. And so we were originally going to break out into discussion groups, but we had a bit of a tech issue. So we're just going to do it all together. So we just want to have a group discussion to get your thoughts on a few key sort of takeaways, aspirations, as we move forward beyond this meeting. So the first question, please feel free to share any responses in the chat or unmute your line and feel free to speak. But we wanted to get a sense of, from your perspectives, how can managed care plans, and we're fortunate that we have IEHP's ear here, obviously, but we'll share this, and I'm sure Molina staff who weren't able to join us today will hear and view this event. How can the Medi-Cal managed care plans promote the overall health and well-being of children and youth? Looking to hear from some of the participants on today's call.
And Fatima, this is Allison. I just wanted to mention and remind you that Alexandra Bravo with Molina, whom you met the other day, she is also on the call with us. So if we do have any questions from Molina, Alex might be able to help us in addition to talking to Dr. Wada with IEHP.
Thank you. Sorry, there's so many boxes and so many. So great to have you all on that I missed that. So thoughts from folks, how plans can help promote children's overall health and well-being. We have folks from all different organizations here, so we'd love to hear your perspectives if you can share.
Hi, I wanted to add to, I think partly Dr. Wada actually mentioned that sometimes getting the patient at the door, like it's a limitation on its own, right? So us as providers, once we have them here, we try to, do immunizations, counseling for nutrition, and do all our part to be able to comply with the quality of care. But if we don't get them at the door, then we just don't have that opportunity. So outreach, I think, is definitely important. And that's why my question as to, like, are there health reminders that are sent to the members of the health insurance? Many times they don't, like, they wait for us to reach out. They wait for us to say, oh, I didn't know that we were due for a physical, or I didn't know that we were due for vaccines. And I think even though internally our organizations try to reach out, I think we do have a limitation on how much outreach we can do, especially with staffing issues and things like that come, on a regular basis. So sending, letters or reminders, I have noticed one of the health insurances lately have been sending like an incentive to the patient. And, you're due for your physical. If you get your physical, you get a gift card. So those things are things that actually get the patients through the door. And then kind of pushes us to then be able to comply with all of the quality metrics that we should be doing on those patients. One thing that was mentioned was trust. And I think that the other thing is that where these communications are coming from, if they're constantly or seeing communications from their health insurance, then they get a little bit more comfortable as to like, okay, these things are coming as reminders and I don't owe anything and I have the right to get these services, versus sometimes they might not even open those letters because they don't have the trust or the knowledge that these are benefits that they have. So I think that outreach is we can do a better job of, and I think that we do depend as providers of that coming from some of like the health insurance, because the people are communicating to you when they're enrolling, for example. So in enrollment, should we give them a list of these are the things that you will benefit from throughout this next year while you're enrolled, so that they have the knowledge ahead of time and say, okay, I can go to the doctor. I don't have the fear of I'm not going to go to the dentist because I don't know if it's covered, or I don't, so those resources I think are important to put up front. And this is just more a comment, but I don't know if anybody wants to add to that.
Thank you. No, that's, I think Dr. Wada definitely talked about that, this is sort of one of the key things that IEHP focuses on. But Dr. Wada, I don't know if I saw you unmute your line if you wanted to comment.
Yes, and Dr. Figueroa, I completely agree. That trust and getting people in the door is one of the keys. And so I'm a big believer in the community health workers. We mentioned that earlier. Health plans. Hopefully IEHP has a good reputation, but health plans in general often don't have the best. And so it's really incumbent on us to get out in the community and be involved. And so we've been putting like health navigators into community settings. We're really looking at our community resources to bring people in for those types of services, and then use the opportunity to make them aware of everything that's available through IEHP. So, it's not just about the bills and those types of things. It's that we offer so much more wraparound services. Or if we don't do it, then we can link and partner with others, through referrals. We have great CBOs and providers in our community. So, yeah, I think that is a very important part of our strategy to improve the overall health of our children.
And I would just add that the Department of Healthcare Services has been working on some messages and materials, some pamphlets and flyers and other things that sort of explain the Medi-Cal benefits for kids in a clearer way, so that families are kind of getting that are getting that basic information in a way they can understand, but that can also reiterate what they're hearing from their health plans and their doctors. So I'm hopeful that those materials will be out soon next year. They've been working on it for a while, but I think that's something that's really been lacking, and you don't know what you can access, right, if you don't know what's available. So I think it's really important.
Thank you. And I just dropped in the chat sort of the guiding questions for this community conversation. Did I hear someone else unmute?
Oh yeah, that was just me. I just wanted to touch down on something that Dr. Wada had, brought to our attention. He said it's coming in the future that you guys are working on transportation for some of the participants to be able to get to, the doctors and dentists and mental health appointments. I was wondering, is there a way that you're going to shed more light on that for some of the patients who don't actually know? Because I know for disabled clients, and there are some clients who doesn't exactly know that it's available to them. So in a way, I think that would be a bigger help for them as well, to be able to get to the doctors, because a lot of them are on fixed income. So that was a major issue that I have heard from a few friends. Their parents, didn't have the money to get to the transportation to get to where they needed to go, whether it was referrals or just in general to the doctor. So is there a way that you're going to highlight that a little bit more to let them know what is available for them to be able to utilize that service?
No, great. Thank you, Ms. Smith, for bringing that up. So transportation is already a benefit through Medi-Cal and through IEHP. So if anybody is having a difficulty getting to an appointment, they can contact our member services and we can help support that and provide the transportation. So you're right, some people may not be aware of that. So that's something that we're really going to be focusing on again in terms of outreach and education to the community.
Thoughts from others in terms of, I see that Danielle shared that, when we think about promoting overall health, we must include a focus on whole person care and the social determinants of health, which I think different speakers highlighted, and she just appreciates all the community efforts and partnerships underway. On that note, can folks sort of take a minute to share your thoughts on how you would define, manage or improve the overall health of children and youth within Medi-Cal? So when you think of the IE community, really thinking about kids and youth, how should we collectively manage and improve their health, and what would health look like for kids? Aspirational vision of health realized for kids in the IE. Can folks share your thoughts on that?
I have a comment. My name's Kenneth Lane. I'm a retired Kaiser Permanente physician, family medicine. I still do a lot of sports medicine. Kaiser is a pretty large Medi-Cal provider as well. And for 30 years, I was part of meetings that sounded exactly like what you are all talking about today. The information that you have is amazing, and particularly with the two moms that are here, you're fabulous. You really nailed everything on the head. But can health plans coordinate with each other? Dr. Wada, do you talk to Kaiser?
We do.
Okay.
Yeah, we talked to Kaiser and here for Medi-Cal, and Molina is the other local health plan.
Because we're thinking about these things all the time, So, okay.
Good. Yeah, I'm sure there's opportunities for improvement, but we do speak regularly. So, for example,
good.
With some of the initiatives coming down the road, like CalAIM, we're trying to align and partner on some of that. And we sometimes can do joint messaging. We did a lot of that with Kaiser. So there are IEHP members who actually get their care through Kaiser, and we partnered with them on some communication strategy, outreach, texting to our members who are unvaccinated for COVID. So we try to do that as much as we can.
Good, because the metaphor that's running through my brain is here's Kaiser and here's IEHP. And if we actually work together, we could close a lot of those gaps.
Yeah, great. Thank you.
Thank you,
I would just like to add too, I think we talk about transportation, which obviously is huge. I see that where I am, there's not even a bus system where I am for children in school. So I think another thing that can also be really beneficial is like mobile clinics. I know that, it's not always available, but there are, people, and I'm sure there's, up and coming young doctors who might need to, get their feet wet. And what a great opportunity, get in the community and meet the people where they are. I mean, yes, it's wonderful that there's transportation available. It's not always easy to navigate that path too. But, I see tons of really great community events where it's, come pick up your fresh fruits and vegetables, get your flu shot, but taking that a step further, we already know children are not coming to their well baby visits. We already know they're behind on their vaccinations. Parents are scared. They are nervous. They are maybe not ready to come out into the world. So maybe making an effort to come to them. I mean, I know it's not feasible for all of your millions of families and members everywhere, but and also in the Inland Empire, we are vast when it comes to geography, right? We have the desert, we have the mountains, we've got inner city, we have everything. And so, you have to sometimes adjust and move where the need is. So for me, I know that there are families, absolutely. I see a mom every day. I've seen her for years. She takes the city bus to get her kids to school because we don't have school buses here. She recently had a baby when I did too, and there she was with her stroller. And you know, she has this gumption and this drive to make sure her family gets what they need, but not everybody is that mom. And so being able to say, hey, we're going to have a mobile vaccine clinic, come get your kids caught up. You know, we know, you know, you haven't come in for your well baby, they're going to need this, this, and that, and we have it available. Or even for, you know, parents, come get your blood pressure checked. I'm sure there's people right now who are, you know, in need of care, and maybe they're only focusing on getting the basics. So I think mobile clinic, it's just like that telehealth. It's another thing that I think is a really valuable asset that isn't necessarily utilized for a lot of organizations.
Thank you, Reyna. And I did want to lift up Gary's comment in the chat, just in case folks are only calling in. One of the learnings that have come through our work in the IE is the need to engage civic and business leaders to, one, become educated on the issues in their backyard. Great point. There are a lot of, it's an all hands on deck. Managed care plans are obviously critical. State agency is critical, but so are local agencies, elected officials, and just us as constituents. And two, help envision the connection. Oops, sorry, my screen moved. Envision connection and solutions. And three, be part of the solution and communications, especially in the more rural areas. So great suggestions, Gary. If you want to elaborate further, feel free to unmute. But any thoughts from other folks in terms of what, looking forward to the years ahead, how we might better collectively support and prioritize children's health in the IE? Any role that specific recommendations for how Medi-Cal can be a key part of promoting that vision and those goals? You can drop them in the chat. You don't have to unmute.
While folks are thinking, I maybe wanted to follow up on what Dr. Lane mentioned in terms of health plans kind of working more collaboratively. And it's making me think about the upcoming population health management service or platform, as that's part of the CalAIM initiative. I know it's not going to roll out for another couple years, but it seems to me that that's a real opportunity to think about the overall health of the population, like in individual health plans within Medi-Cal and within the region. So I don't know, Dr. Wada, if you have any early thinking on the promise that the population health management service can provide.
Yeah, we are interested to see, what that's going to look like. We do have our local health information exchange. Not all of the providers are participating on that, and so we try to get as many of our providers onto that as possible, so that the data is centralized and it makes it easier for care coordination. And so looking at sort of the population health management, I think that is really valuable. We'll kind of see what that system looks like. We do some of that already, and I know some of our bigger providers have that capability. One of the challenges that we have in terms of our providers, was mentioned earlier. I mean, we have such a vast geography, and we have a lot of solo and smaller practice doctors that may not have that sort of sophistication. So we can create these great incentive programs, but we need to make sure that we support our providers to have the tools necessary to manage their population. I mean, they're doing a great job. Everybody wants to do a great job, but sometimes they don't have those additional programs or software to do the analysis, to identify their patients that have asthma and make sure they're connected with the resources. And so for us at IEHP, we're looking to do that. We're doing some work in supporting our providers to have electronic health records. And so, yeah, definitely an important piece of the solution to try to improve the healthcare.
Thank you. And another note from Gary that there are real cost benefit stories that break through political, racial, and other prejudices. And that kind of messaging could come from / within Medi-Cal operations. So I think the big themes today have been one, this more holistic community view of what it's going to really take to promote the health and well-being of children. It's really an all hands on deck. The great thing is we're in a time when that is precisely the context that Medi-Cal is sort of moving in and flowing in through state investments, changes in state requirements. There's a much more welcome and renewed focus on eliminating health disparities at the state level, as Mike noted. So there really is, there's a shift that's happening. And we hope that you all see yourselves as critical to making sure that shift promotes the best outcomes for kids locally and across the state, but for really all children, that we see these closing of disparities and that we start to create a more broad network of what support is available to achieve those optimal outcomes for kids. I'll ask one last time if there are any other thoughts or input from the group on the community questions.
I just have a quick comment. I would suggest that everyone you know, find out what your policymakers' positions are on these state and local initiatives and thank them if they're supporting things like AIM, because I'm sure that there are huge conversations in terms of the cost, and to be supporting these kind of revolutionary programs, they should be thanked.
Thank you. And one comment from Danielle: Medi-Cal expanding, but some people, such as parents, are still left out of coverage. So would love to see health coverage expanded for all people. Also increased provider reimbursement, support for workforce and medical staff, health homes, increased equity data sharing and tracking of social determinants of health. So many goals. Yes, so many goals, so much happening, so much progress, and still so much more to do. But Dr. Pina, who is no longer with us, she had to hop off, said we shouldn't see these long-term, it is a marathon. We'll have fun in the sprints as we get there, but we'll get there eventually. Okay, well, thank you all so much for expanding upon your thoughts, your input as we sort of navigate this space. With that, I will hand it over to Allison, so maybe we can end a little early, get some food, some more food in our bellies. I know I need some, but I'll also drop in the chat a evaluation. We'd love to hear your thoughts. We're going to have these similar community conversations in other areas, so your input, your first group, we'd love to hear what worked, what didn't, and any insights so we can engage with other folks across the state. So with that, I'll hand it over to you, Allison.
Well, my goodness, what a session. Yes, I'm with Dr. Lane. Let's do a round of applause for all of that and all of you, but especially Fatima Clark and Mike Odeh with Children Now. We want to thank you so much for just a really substantive presentation and something that had so many different nuances to it and ways that we could really explore this topic in depth. It was data-driven, and you facilitated some very targeted questions for our panelists and really drove the discussion. So that was absolutely amazing. Thank you. And thank you also for, you were sponsored this session as well, but you were phenomenal. And we're extremely honored and fortunate to partner with you on this today. Just a reminder, we will send out the slide deck and the recording from today's forum, along with any contact information for our presenters and any other information that is pertinent in the follow-up. I do want to just go back real quickly and thank you to all of our amazing additional presenters. Dr. Takashi Wada from IEHP. Wow, that's absolutely phenomenal information, very comprehensive. And thank you for all you do. And Dr. Gabrielle Pina with Loma Linda University, who, as Fatima said, did have to jump off, but does such wonderful work in the pediatric space. Dr. Brenda Figueroa with Borrego Health, taking care of so many in our community that are most in need. Thank you, Dr. Figueroa. And Ms. Reyna Sanchez and Ms. Janiero Smith, the parent representatives. Wow, you guys really were show stealers. I've seen so many comments back and forth here on the chat about how absolutely phenomenal you were and how valuable your input has been. And not only that, but I think everyone is so impressed with how engaged you are and that you're really advocates for your own family and your own families and your own health. And that's hard to do when you have a lot of other things to focus on. But thank you for being with us. You guys are really, really amazing. And we want to keep working with you. So thank you.
I second that.
Yeah, it really, everyone was just struck with the same notion there. I also do want to thank our San Bernardino County Medical Society staff, and especially Janice Solorio, who really kind of stepped in above and beyond today to do some extra preparations here for this meeting. And again, it was just a lovely partnership. So I think we all learned a lot. And Fatima and Mike, you guys rock. You guys are rock stars. So we will look forward to staying in touch. And on behalf of IEHP and all our partners, we thank you all so much. And we hope you have a wonderful, oh my goodness, we're getting towards the holidays. I'll just say happy holidays now and let that be the blanket statement. Thank you, everyone. Have a great week. And we'll see you next time.
Take care, everyone.
Thank you. Bye-bye.